Every year in the United States, nearly 800,000 people suffer a stroke. According to the CDC, 3 out of 4 strokes happen in adults over the age of 65. And here's the part that's most alarming. In up to 85% of cases, the body gives off warning signs hours or even days before the stroke happens. But most people don't recognize them, or worse, they ignore them. It's just stress. I didn't sleep well. I probably stood up too fast. Excuses like these are the reason why only 1 in 10 stroke patients arrive at the hospital in time to receive life-saving clot-busting treatment. Let me tell you a story. Edward, a 71-year-old retired teacher, felt a strange numbness in his left fingers one morning. He shook it off. Then, later that day, his speech slurred slightly when he ordered lunch. He told himself it was just dehydration. But that night, he collapsed in the kitchen. The stroke had been building quietly. The signs were there. But like many older adults, he didn't know what they meant. That's why this video matters. Because stroke doesn't always start with a dramatic collapse. Sometimes, it whispers. A tingle in the hand. A sentence that doesn't come out right. A brief wave of dizziness that fades just as quickly. According to a 2020 report from the National Institutes of Neurological Disorders and Stroke, more than 60% of seniors who experienced a minor stroke or TIA, transient ischemic attack, had at least one early warning symptom that they dismissed. Yet research shows that when these signs are caught early, the chance of full recovery increases by over 70%. So today, I'll walk you through 7 early signs that your body may be on the verge of a stroke. I'll explain what they look like, why they happen, and what you must do if you, or someone you love, experiences them. Because after age 60, staying independent isn't just about staying active. It's about staying informed. And when it comes to stroke, what you do in the first hour can mean the difference between walking away or never walking again. Sign number 1. Sudden weakness or numbness on one side of the body. It often begins quietly. You reach for your coffee, but your fingers don't respond. Or your leg feels heavy, like it belongs to someone else. There's no pain, just a strange sense that something isn't right. You might think, maybe I just slept on it funny. But that small change could be the first sign of a stroke. What's happening inside your body? During a stroke, blood flow to a part of the brain is blocked. And because each side of the brain controls the opposite side of the body, this loss of blood can suddenly affect one arm, one leg, or one side of your face. That's why it's often the left hand that drops the fork, or the right leg that feels too weak to step forward. Without oxygen, brain cells begin dying within minutes. And the longer you wait, the more brain tissue is lost. Here's what the science says. According to the American Stroke Association, more than 70% of stroke patients report sudden weakness or numbness, usually on one side of the body. A 2019 study published in The Lancet Neurology found that people who ignored these symptoms were 6 times more likely to suffer a major stroke within the next 48 hours. And research in the Journal of the American Geriatric Society shows that older adults often don't feel pain during early stroke symptoms, making them more likely to dismiss the warning signs. A real-life example, Claire Robertson, 75, from Ohio, woke up with a strange tingling in her left foot. She thought it was from the cold. An hour later, she dropped her spoon at breakfast. Her left hand had gone weak. Thankfully, her husband had recently watched a video on stroke signs. He called 911 immediately. Claire was treated within 90 minutes of her first symptom. And because they acted fast, she made a full recovery from what could have been a life-altering stroke. What to do? If you or someone you love suddenly feels weakness in one arm or leg, numbness on one side of the face, or can't lift both arms evenly, don't wait, don't guess, call 911. Even if it goes away, even if you feel fine a few minutes later. With stroke, time lost is brain lost. Acting fast can mean the difference between a full recovery and permanent disability. Sign number 2. Sudden trouble. Speaking or understanding speech. Imagine this. You're in the middle of a conversation, and suddenly, the words just don't come out right. Or worse, someone is talking to you, and you can hear their voice, but the meaning doesn't make sense. You may try to speak, but your words come out slurred, confused, or not at all. For many stroke survivors, this is one of the first signs something is seriously wrong. It may feel like you know exactly what you want to say, but your mouth and brain aren't connecting. What's happening in the brain? This symptom is caused by a disruption in the language centers of the brain, typically in the left hemisphere. These areas control how we form words, understand language, and communicate clearly. When blood flow is cut off, even for just a few minutes, the brain struggles to send the right signals, and speech becomes disorganized or completely blocked. What the research shows, a 2021 study published in Stroke, a journal of the American Heart Association, found that over 30% of stroke patients experience sudden speech problems in the first hour of a stroke. The fast stroke test used by emergency responders includes S-actions speech. Because speech disturbance is one of the most telling and time-sensitive signs of a stroke. According to the National Institute of Neurological Disorders and Stroke, patients who receive medical care within 3 hours of their first speech-related symptom are significantly more likely to recover without lasting disability. Real story. Robert, a 68-year-old Vietnam veteran from Kansas, was telling his granddaughter a story when she noticed his words slurring. He laughed and said, "I guess I'm just tired." But she remembered a school presentation about strokes. She asked him to say a simple sentence again, and it came out jumbled. She called 911, and doctors confirmed he was having a mild ischemic stroke. Thanks to her quick action, Robert was treated within the critical window. And today, he's back to reading books aloud to his grandkids. What to watch for? Be alert for. Sudden slurring of words, saying the wrong words without realizing it, difficulty understanding simple sentences, trouble naming everyday objects, speech that just doesn't sound like you. If it comes on suddenly and doesn't improve within a few minutes, call 911 right away. In the case of a stroke, silence isn't just frustrating. It's a neurological emergency, and the sooner you act, the better your chances of full recovery. Sign number 3. Sudden vision problems in one or both eyes. 1 minute, you're watching TV. The next, a part of the screen goes dark. Or you're reading the newspaper, and the words start to blur or disappear. Some people describe it as a gray curtain dropping over one eye. Others say it's like looking through a broken mirror. It can come on suddenly and vanish just as fast. That's what makes it so easy to dismiss. But sudden vision loss, especially in just one eye, is often a silent warning sign of a stroke in progress. What's happening in your brain? The optic nerve and visual cortex, which process what you see, rely on steady blood flow, especially from arteries in the back of your brain. When a stroke affects these areas, it can temporarily or permanently block signals from your eyes to your brain, even if your eyes themselves are perfectly healthy. That's why some stroke victims say, "My eye felt fine, but it was like my brain couldn't read what it saw." What science tells us, according to a report from the American Academy of Ophthalmology, sudden painless vision loss in one eye is a red flag for a retinal artery occlusion, often called a stroke in the eye. The National Eye Institute warns that up to 25% of patients who experience this will go on to suffer a full stroke within 1 week. A 2020 study in neurology found that seniors who reported sudden vision loss, especially blurred, double, or tunneled vision, were 2 to 4 times more likely to suffer a stroke within the next 30 days. A real-life story. Ms. Lorraine Jacobs, 79, was baking cookies when her left eye suddenly went dim. She rubbed it, blinked. It cleared up a minute later, so she didn't think much of it. But the next day, it happened again, only worse. Her daughter drove her to the ER, where doctors discovered she had experienced a mini-stroke in the visual area of her brain. Because they caught it in time, doctors were able to prevent a much more serious stroke from occurring days later. What to look out for? Be alert for. Sudden blurred vision. Double vision. Partial or complete loss of sight in one eye. Trouble seeing to one side, especially if you bump into objects. Sudden inability to read or focus. These may not be painful, and they may come and go. But don't ignore them. Even a brief episode could be a TIA, a transient ischemic attack, or mini-stroke, and a critical warning that a major stroke is on the way. If your vision changes suddenly, even for a few minutes, call 911. Because in a stroke, your eyes may see it first, even before your brain understands what's happening. Sign number 4. Sudden dizziness, balance problems, or loss of coordination. You're standing up from a chair, and the room tilts for a moment. You take a few steps, and suddenly feel wobbly, like you've lost your footing. Or maybe you bend down to pick something up, and feel like you're going to fall over. These aren't just signs of getting older. For many seniors, sudden dizziness or balance problems are one of the earliest symptoms of a stroke, especially strokes affecting the cerebellum or brainstem. And here's what's dangerous. Most people assume it's dehydration, low blood sugar, or fatigue. So they wait. And while they wait, the stroke progresses. What's going on inside the brain? The cerebellum, located at the base of the brain, is responsible for coordination, balance, and posture. When a stroke disrupts blood flow to this area, your body struggles to stay upright. You might suddenly walk like you're off balance, or feel as if the floor is shifting beneath you. Strokes in the brainstem are even more dangerous because they control vital functions like breathing, heart rate, and movement. What the research shows, according to a 2022 report by the American Stroke Association, over 40% of patients with posterior back of the brain strokes report dizziness or imbalance as their first symptom. A study published in Stroke, Journal of the American Heart Association found that 60% of cerebellar strokes in older adults are misdiagnosed during the first ER visit, often mistaken for inner ear problems or vertigo. Seniors with balance-related symptoms who delay care are twice as likely to suffer permanent disability compared to those treated within the first 3 hours. A real story. Mr. William Harris, 76, was gardening when he stood up and nearly toppled over. His wife thought he was just lightheaded. But 20 minutes later, he had trouble stepping forward and reached for the wall to keep from falling. At the ER, scans revealed a cerebellar stroke, one that could have left him wheelchair-bound if he hadn't gotten help in time. Today, William walks with confidence because they listened to the warning. What to watch for? Sudden loss of balance or unsteady walking, trouble standing upright, dizziness or feeling the room is spinning, difficulty reaching for objects or coordination loss, falling for no clear reason. These symptoms might seem mild or easy to blame on aging, but when they come on suddenly and you haven't experienced them before, it could be your brain's way of crying out for help. And in stroke care, a 10-minute decision can change the next 10 years of your life. Sign number 5. A sudden severe headache. With no known cause. It comes on like lightning. A sharp, pulsing headache. Sudden, intense, and unlike anything you've ever felt before. Some describe it as a thunderclap. Others say it felt like pressure exploding inside the skull. It might be accompanied by nausea, blurred vision, or even vomiting. But it almost always comes without warning. Most of us have had headaches before. From stress, from skipped meals, from too little sleep. But this kind of headache is different, and for some seniors, it's the only sign that their brain is bleeding. What's happening in your brain? This type of headache is often associated with a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts. The pressure from the leaking blood can quickly damage surrounding brain tissue, increasing the risk of coma, permanent disability, or death. And unlike ischemic strokes, which block blood flow, hemorrhagic strokes often give no early warning. Except one: a headache that feels completely out of the ordinary. What science tells us, according to the National Institute of Neurological Disorders and Stroke, 1 in 10 strokes in older adults are hemorrhagic. And nearly all of them begin with sudden, severe head pain. A study in the New England Journal of Medicine found that over 70% of seniors who experienced a hemorrhagic stroke described their headache as the worst pain of their life. Delaying care by even 30 minutes in these cases can increase the risk of fatality by over 50%. A true story. Mrs. Angela Ruiz, 73, had just finished her morning crossword puzzle when she felt a blinding ache hit the back of her head. She tried to lie down, thinking it was just a migraine. But when she began slurring her words minutes later, her daughter called 911. At the hospital, doctors confirmed a small brain bleed. Because she was treated quickly, Angela avoided surgery and made a full recovery. Her doctor told her plainly, "That call saved your life." What to look out for? A headache that comes on suddenly and feels severe or explosive. Pain unlike your usual headaches. Headache paired with nausea, confusion, or vision changes. A feeling of pressure inside the skull. No clear cause. No fever. No sinus pain. No dehydration. Headaches can have many causes. But if you're over 60 and feel a headache that's sudden, intense, or just feels wrong, don't wait it out. Call 911. Get checked. Because in cases of brain bleeding, waiting even a little can be fatal. Sign number 6. Sudden confusion or trouble understanding. Everyday situations. You're at the grocery store and suddenly forget why you're there. Or someone asks you a simple question, and you pause, unable to find the right words. You look around a familiar place and feel momentarily lost. We all experience senior moments from time to time, forgetting a name, misplacing your keys. But this is different. It's not just forgetfulness. It's sudden confusion, a break in your ability to think, understand, or process things that normally come easily. What's happening in the brain? When a stroke begins to affect the frontal or parietal lobes of the brain, areas responsible for reasoning, language, and memory, even simple tasks can feel impossible. You might know you want to speak, but can't form the words, or you may feel foggy, as if your thoughts are scattered or slipping away. Medical research confirms. A 2018 study in JAMA Neurology found that over 25% of seniors who suffer a mild stroke report confusion or disorientation as their first noticeable symptom. According to the American Stroke Association, confusion, poor judgment, and memory trouble are more common in right hemisphere strokes, which often go undetected longer than left-side strokes. And in patients over 65, delirium or sudden cognitive fog is sometimes the only sign of a stroke in progress, especially in those with pre-existing memory issues. A real example, Henry, a 74-year-old former postman, was making coffee when he forgot how to use the machine he'd used for years. His wife asked if he was okay. He looked at her blankly and replied, "Where are we going again?" She thought it was just mild confusion, but within the hour, he couldn't recall the names of their grandchildren. They rushed to the ER, where doctors diagnosed a small stroke affecting Henry's frontal lobe. Because they caught it early, his memory returned within a few days, and he went home without permanent damage. What to watch for? Difficulty understanding spoken or written words. Trouble following simple instructions. Confusion about where you are or what time it is. Saying things that don't make sense. A sudden change in personality or behavior. Stroke can affect more than just the body. It can steal your clarity, your presence of mind, even your sense of self. If someone seems suddenly confused or not quite themselves, don't wait. Time is brain, and confusion could be the brain's final cry for help. Sign number 7. Sudden trouble walking or loss of balance and coordination. You stand up, and your foot doesn't feel right. You try to walk across the room, but your stride is uneven. Your leg feels weak, or the floor seems to tilt beneath you. You reach for a glass of water and miss it entirely, or suddenly find it hard to button a shirt, hold a spoon, or tie your shoes. These moments can feel strange, maybe even embarrassing, but they may be more than clumsiness or aging. They may be a neurological red flag. What's going on inside the brain? Walking, balance, and coordination rely on a network of brain regions, especially the cerebellum, motor cortex, and brainstem. When a stroke affects these areas, even everyday movements become a challenge. The brain can no longer send smooth, controlled signals to your arms and legs, and that disconnection can cause your body to stumble, drag, or freeze. Here's what medical studies reveal. According to the National Stroke Association, over 35% of stroke patients over age 65 report sudden difficulty walking or loss of balance in the first 30 minutes of a stroke. A 2021 study in Frontiers in Aging Neuroscience found that impaired gait, especially slower steps, wider stance, or dragging one foot, is an early sign in over 40% of mild to moderate strokes in seniors. And most importantly, falls in the first hours of a stroke often result in delayed diagnosis because caregivers mistake it for weakness, arthritis, or fatigue. Real-life story. Mr. Leon Bradley, 80, was walking his dog like he did every morning. But halfway down the block, he felt his right foot dragging, and then he couldn't lift it at all. He tried to turn back, but stumbled into a fence. Thankfully, a neighbor saw him and called 911. Leon had suffered a mild ischemic stroke in the motor region of his brain, and because help arrived quickly, he was walking again, without a cane, within 2 weeks. What to watch for: sudden difficulty walking or staggering, dragging one foot or leg, loss of coordination in hands or arms, trouble with simple movements, e.g., buttoning clothes, sudden dizziness or swaying while standing still. Stroke doesn't always strike with drama. Sometimes it disguises itself as a small stumble, a missed step, a shaky hand. But when these symptoms appear suddenly, and especially if they're new, they are your brain's cry for urgent help. Don't guess. Don't wait. Call 911 immediately. A stroke doesn't always begin with sirens, collapsed bodies, or dramatic moments. Sometimes it begins with a whisper, a strange tingle in the arm, a word that comes out wrong, a glass of water that slips from your hand. Each of the 7 signs we shared today, sudden numbness, slurred speech, vision loss, imbalance, intense headache, confusion, trouble walking, may seem small on their own, but together they can be the difference between recovery or disability, independence or long-term care, life or death. According to the CDC, over 80% of strokes are preventable, not just by managing risk factors like blood pressure and cholesterol, but by recognizing the signs and getting help fast. If you or someone you love experiences any of these symptoms, even for just a few minutes, don't wait to see if it passes. Call 911. Get to the hospital. Let doctors decide what's wrong. Because with stroke, every second counts, and every moment you wait, more brain cells are lost. Brain cells responsible for walking, speaking, thinking, living. At Senior Health Tips, we believe aging should come with wisdom. And that includes knowing when your body is telling you something is seriously wrong. So share this video, watch it with your spouse, send it to your children, your neighbors, your caregivers. Let's make sure no one ignores the signs. And if this video helped you today, please click the like button, subscribe to stay informed, and turn on the bell so you never miss a health tip that could save your life. Thank you for being here. Stay safe. Stay strong. And remember, you're never too old to listen to your body. And act with courage.